Waiting for a patient's molecular profile via tissue could take, like you guys are just talking about, 3 to 4 weeks. What is an acceptable time frame? Dr. Hart?
Well, clearly less you can wait, the better. There have been studies. There was a study that I know of from Canada where they found that patients that were treated uniformly throughout their country, since obviously they have a socialized medical system, so any difficulties with reimbursement, et cetera, drop out. So in their socialized system, they did find independently the patients that were treated, I believe it was within less than 30 days versus more than 30 days from their original diagnosis, had a difference in their outcome. So, there clearly is with an aggressive cancer. I always tell patients, a day or two here or there does not matter. Cancer is not doubling every day, but it certainly seems to the patient like it's doubling every day. So their mental status is, really impacted by delays. Again, the patient's family that I talked to today was of that same opinion. They don't want to hear about being 3 days more, 7 days more, 10 days more till we get results. They want to know, what's the prognosis of their loved one and when can they start treatment as soon as possible. So obviously, if we can move this up and do it quicker, that's going to be very advantageous. For example, another quick scenario, I had an Asian woman recently came in who was a non-smoker and had a lung adenocarcinoma. I felt it was fairly likely that she would have an EGFR mutation. And indeed, the liquid biopsy did show that very quickly that she had EGFR exon 19 mutation. So we were able to get the patient started on treatment much more quickly than it would have taken for us to go ahead and get her if we were just solely relying on the tissue. And in addition, another point is that these treatments are all quite expensive, whether it's osimertinib, whether it's a checkpoint inhibitor, other targeted agents. These are expensive treatments. You have to, it takes a few days to get reimbursement lined up, especially for an oral drug. Make sure that you go through the correct specialty pharmacy to get the drug. That takes a few days also. So that's even this tissue time is not even taking into account the time it takes to get reimbursement and everything else set up after you have the diagnosis before you can actually treat the patient. So the sooner we can get this process started, the better. No question about it.
That's an excellent point. Thank you for sharing. Dr. Reeves? You're on mute, Dr. Reeves.
Sorry, I just echo what Dr. Hart said. The sooner the better in terms of getting this information in, and hopefully technology will continue to improve.
Thank you. Dr. Walker?
Again, I completely agree with Dr. Hart and Dr. Reeves. One observation on time. No question, any patient, the diagnosis of cancer, death hits you, and you want to get going as quickly as possible. But you need the right therapy, matters more than time. But it's not a turnaround time from a test. For example, everybody will talk about how long does it take to get this next generation sequencing back from liquid, 7 days, from tissue, 2 to 3 weeks. It's the time from diagnosis to beginning treatment that makes a difference in survival. As Dr. Hart mentioned, there's a Canadian study in non-small cell lung cancer. There was also a meta-analysis from a year ago, over 8 cancers treated with whatever modality, surgery, radiation, systemic therapy, and mortality began to increase, survival began to drop once there was a 4-week delay from the time from diagnosis. For that time to diagnosis to getting started to treatment is something that's so important because it does impact outcome.